Hello, viewers. Welcome to the another episode of podcast series on respiratory health in pediatrics. I am Dr. Arunima here, Associate Professor, Department of Child Health Nursing, Bharati Vidyapeeth deemed to be University, College of Nursing, Navi Mumbai. Today's topic is Breathe Easy in Monsoon. We have our resource person, Dr. Chithra Kulkarni. Madam have 40 years of experience in clinical field of pediatrics. She is qualified as a MD pediatrician. We are so happy to have Madam for today's session, ma'am. Ma'am, can we start?
Yes, please.
Ma'am, today's first question is on breathe easy in monsoon. So the first question goes to you is like uh, how riskful monsoon season for children in terms of respiratory health?
Yeah, definitely. People stay more indoors in this monsoon season. They cannot roam around. And in India, there are small places where there is always overcrowding, especially in the cities. The airborne transmission of these viruses is much more in rainy season. And the third important thing is the mosquito borne illnesses like dengue, malaria, chikungunya are also more because of water clogging, which reduces immunity of the population and children, and which leads to low immunity as well as anemia, which increases the chance of getting other infections on top of it. And so we always get more cases of upper respiratory pneumonia or laryngitis in children in monsoon season.
Okay. Ma'am, my second question is, does this humidity have any kind of impact, especially during the time of monsoon?
Yeah, it's like dabba ban. The clouds over our earth reduces the air currents, which increases the number of germs in that particular area, especially in our Mumbai and Navi Mumbai area. And all allergic problem like allergic rhinitis, sinusitis, cold, ear infections, asthma, those people who are allergic, they react to this increased humidity. Then allergic problems are also more in under 5, plus pollution, the vehicular pollution and particulate matter which remains near the ground. The child of 2 or 3 feet height inhale it more frequently and more times in our area as compared to other area where there is lot of good air current and less humidity. They get exposed to the garbage which is having more toxic gases and carbon monoxide, which also increase the risk of having allergies and asthma, and sometimes there is secondary infection in these clogged secretions which can cause pneumonia also.
Ma'am, in continuation with the second question, so what should be the warning signs we should watch in children when they get affected with respiratory problems?
Yes, I'm very thankful for this question, because here anticipatory guidance is very, very important. I always tell my patients that watch for fever. First 1 or 2 days, when it's high fever, if the child is completely normal, having his normal activity and playfulness, wait for 2 or 3 days, give paracetamol, hydrate that child very well. A child passing good amount of urine which is colorless, that means the baby is well hydrated, and then you can wait to go to doctor if the child is playful. If the baby, in spite of not having fever, very dull, the activity is less, child wants to sleep more, 4 to 6 hours of sleep, still not waking up and not active, we have to raise an alarm. Secondly, look for the hydration. If the child is having sunken eyes, dry tongue, not want to sit or play, and then always find for vomiting. A vomiting child is having double burden of high fever and vomiting, which may increase dehydration and the problem may worsen. So it's a red flag sign. Decrease appetite, decrease playfulness, and irritability, continuous cry, like whining, crying, kar raha hai, not eating, you always have to go to a doctor. And before that, start ORS, oral rehydration solution, according to the age of the child, and that we have to prepare at our home, not the ready-made bottled ORS.
Thank you for briefing me, ma'am. And along with this question, so just a reinforcement points for parents to when they should seek the medical attention.
Yeah, gastrointestinal problems are also more along with respiratory problems in this age group. Means a child having respiratory virus infection like flu can vomit also. And like nosy, he or she may pass 3 to 4 times of motions also. So it is not gastroenteritis. It can be a viral infection like flu, and which is having multi-system symptoms. So if the child is having all these symptoms, then yes, we have to rush to a doctor. Second important thing, the fever which is not reducing by paracetamol. The fever which reduces by paracetamol comes to 9900 and again increases after 4 to 6 hours, we can wait. But if there is no effect of paracetamol on the child's fever, it remains as 101, 102, then yes, we have to go to doctor. Third thing is increase respiratory rate. If the child is breathing more than 30 times in a minute, then yes, it is a red flag. If the accessory muscles of respiration are in action, like flaring of LA nasi, increase sound of respiration and increase movement of the neck muscles and head bobbling in infants, yes, we have to rush to a doctor.
Even chest retractions, stellar retractions can also watch.
Yes. I told it in layman's language. Yes.
Ma'am, especially in Indian scenarios, we go for home remedies. Any conditions, we go for home remedies. Any kind of home remedies, you can just brief on this topic.
Definitely. And we have to respect all the grandparents and our home remedies, because we just reiterated, again I am telling, hydration is very important. Cleaning the nose is also very important. Many of the times it is just a mucus plug which is causing problem of vomiting, not eating, and when we clear it with massage and steam, it will help. Another popular home remedy is haldi wala doodh. That is also good. Giving turmeric milk sip by sip will also help. It will reduce the dehydration. It may increase the immunity. And adrak and honey is also very good. Like ginger honey paste, 1 or 2 drops you can give to toddlers and infant 2 or 5 times in a day, and give lot of fruits. That is the misconcept I want to reduce, because giving fruit will give good ready energy and minerals, which will help to improve the immunity of the child.
Okay, ma'am, any suggestions like which fruits to be included and which fruits to be excluded?
Yeah, very nice question. Foods rich in vitamin C. Guava, it's very nice. It is not costly. Oranges and pomegranate definitely will help to increase the immunity by increasing vitamin C level. And the local fruit, papaya, having lot of vitamin A, along with like carrot and beetroot soup or smoothie, will definitely help to improve the immunity. Along with complex carbohydrate like rice kanji, the child accepts very well. Poha ka pani, soups, and more of liquids. After 4 or 5 sips, they may stop. But again, you can try within next 30 minutes. They can again take 4 or 5 sips, and that way the child remains in positive energy balance, which will improve the immunity.
Ma'am, like what is the role of vaccination here?
Very important. We are having 2 seasons of flu. In our middle part of India, it starts in June. But the uppermost part, like Jammu Kashmir and Chennai, it is the receding monsoon of October, November, where the flu is more. Flu is totally 100% preventable disease, and we are having very good vaccine in form of flu vaccine, which can be given every year, once a year, in June in this part, and in September in Chennai and in Jammu Kashmir.
Ma'am, in association with that question, so what vaccine is definitely a preventive measure which health workers boost or aware the.
Yes, fortunately, we are having pneumonia vaccine in government program,
Okay.
which reduces 60% chance of pneumonia of pneumococcal vaccine. Other germs are still there to cause pneumonia, but the flu vaccine is like that, which is now recommended as trivalent flu vaccine, which has reduced the cost of vaccine also, has to be taken yearly.
Okay.
And it can be taken from 6 months of age till the geriatrics also.
Ma'am, along with vaccines, any other preventive measures which we can include, which you suggest?
Very, very important. It is not only for COVID, it is to reduce the respiratory illnesses as well as allergies. The number of particulate matter going inside our nose reduces with simple mask. If a person is not well, if he or she chooses to wear the mask and asks the child to wear the mask, the transmission of the virus will also reduce. Along with that, good homemade food is very, very important. Freshly prepared, freshly cooked homemade food, we have to advocate to parents, so that the preserved and packet food, which is just for test, the consumption will reduce and the child will get more nutrition out of the small portions they eat.
Okay. Thank you, ma'am. Ma'am, ventilation will be definitely a part, especially in terms of monsoon. Since we have discussed on humidity, ventilation is also an important factor which goes for the pros and cons of respiratory health. So, what is your opinion on that?
Yes, it's a very important thing, especially in cities where everything is having air condition. Even a daycare center is
Yes.
having air condition, their nurseries are having, and the homes are also air conditioned, where the same air gets circulated. So our advice is, after 4 to 5 hours, we have to open all the windows and door to take the fresh air inside, and then you can restart the AC.
Okay.
Again, most of the big buildings, they keep the AC on 16 or 18 degrees centigrade, which is not required. The comfort zone for our skin and eyes is 25 and 26 degrees. So for a child to be playful and active, we have to keep 25 or 26 degrees of temperature in the AC when AC cannot be avoided. The best is well ventilated room, where the air goes from one window and goes out from other window or door, is the best practice.
Okay. Since we discuss on pediatric health, ma'am, schools also remain a major part in their health. So, for how schools can do, can they do something, or if they can, what can they?
Definitely, 5 to 6 hours a child is in school, and in school age group we see that, especially in cities, both the parents are working. The child goes to school, then goes to daycare, and by 7 the child is picked up for home. So here the transmission of the viruses, it increases.
Yes.
So keeping a sick baby, the baby who is not well, at home is a better option to prevent the transmission of respiratory viruses. Second important thing is, if it is not possible, at least we have to triage these 6 babies in the daycare center. School nowadays here in our area, they always see that the child should be at home when the baby is not well. If the baby is not well, they have to inform the parents, and the parents they take home. But in daycare, many of the times the parents opt to keep them because the mother and father is busy and cannot take leave. So there they have to triage those sick babies. They are not allowed to mix with the other babies of daycare, that we have to tell them. Another thing which is very, very important in India is to see that the child doesn't spits, and they see it in roadside. Sometimes we have seen that the staff who is working in the school and daycare, they also having that spitting habit. It is not only tuberculosis which is transmitted by spitting, but all other illnesses are also transmitted. So we have to educate our paramedical workers and non-medical staff also to avoid spitting, and especially in front of the children and in school areas. Third and very important thing is to increase the awareness. We have to put on the boards in each and every corner not to spit. Cover your mouth when you are coughing or sneezing. When you cover with your hand, the germs they go to our hand. But if we cover by our elbow, many of the times this part is not touched by our own self, and the transmission may reduce. Fourth important thing, like all the children in school are allowed to do, is hand washing. If we do frequent hand washing, the transmission it reduces. And when we increase this awareness by putting on the boards, giving awards, definitely we can curtail the transmission of respiratory infections in monsoon season
We can break
and
the
throughout
chain.
the year.
Yes. We can break the chain.
Yes.
Ma'am, the final question to you is like how community awareness or how community can help in reduction of these issues or health problems.
Yes, very nice. In Marathi, we always see there is a board, Manacha break, Uttam break. So the best break is our action, which we have to see what we are doing. The first and the most important thing is avoid garbage outdoors. Our home and school is very, very clean, but outside the road, on road, we see lot of garbage, and which can cause more infections to our children. So if we do some rallies, community awareness programs, giving out prizes with help of all the NGOs like Rotary International, Lions, or our association, to reduce this unclean behavior, and by increasing our own motivation to reduce it, definitely it will have a good impact to reduce the overall illness in monsoon season.
Thank you, ma'am. Thank you so much. Thank you for your information, and thank you for the time which you has given.